Well, welcome. This is our continuing series on getting to know our faculty, and we're really lucky to be talking today with Dr. Badi Rawashedeh. And Badi, thanks so much for joining us. Badi's an instructor in the Division of Transplant Surgery, and we'd love to know a little bit about your background, where you grew up, and how you ended up in medicine.
Yeah, I thank you very much for inviting me, Dr.
Sure.
Evans. I appreciate the time. And actually, I born and raised in a small town in Jordan.
Wow.
For family surrounded, I was surrounded always by physicians, actually successful physicians in Jordan, surgeons and internists. And
Wow.
I always want to be in medicine. I wanted to be one of those people in Jordan, my village specifically, that people always talk about them, about their success. And I was lucky that.
So you were going to be a doctor from age like 5 or 6 then?
Literally from that age, I wanted to be in medicine. My father always wanted me, and my mother was a teacher, wanted me to be like those people who are like successful, and everybody talk about what they do.
Sure.
I was lucky to be like in my home, my school. In between there was a small primary care center where I was always seeing those people with lab coats and see what I was very impressed by what they do every time I go for appointment or something with my family. I always, like my mother would remind me now, like always, about the question that I used to ask: if you want to open the heart, where do you open it, or something like that, from like when I was there small. Like, so yeah, I was I think part of it is the people around me.
Sure.
Like,
really neat.
Yeah.
Tell me about the medical education in Jordan. I mean, how it's a little bit different than the United States?
It is. Actually, it's very hard to get into medicine in Jordan. I'm sure it's pretty hard here, but in Jordan you have to have like very high scores and very limited very limited seats, especially when I was there like around 20 years ago. I couldn't match in Jordan. I had to go back, go to Iraq to spend my first 3 years after the war started. Have to go back to Jordan to finish my clinical years. So medicine in Jordan is like about 6 years.
And so is high school in Jordan similar to high school here, or is it a little different?
It's a little different. Like after the high school, you can go to the college immediately to do the medicine. So after high school, immediately you go to.
So it's similar to the British system then. You go from the equivalent of high school, you go straight into medicine.
Yes.
And then how did you decide to do surgery?
So it started by first day. I was actually my clinical year in Jordan when I was in ED rotation, not even surgery. I helped with diagnosis of appendicitis for a small kid. Then they said, "Hey, you can come to join us in the OR." I said, "That's fine." And when I first moved to the OR, I saw the appendix. I saw how they took it out. I was like very impressed by that. And you think like, wasn't that new in Jordan, but laparoscopic surgery, it was like something.
Sure.
At that time, I'm not that old, but I think 2004 or something. The room beside our room, the appendectomy room, was lab colleague. So I saw the laparoscopic techniques. How do they do it on the cameras? I was
so neat.
Yeah,
really neat.
Yeah, that time. So I decided that surgery is my thing to do.
And so, how did you go from deciding you're going to be a surgeon to further training and then landing here in the great city of Milwaukee, Wisconsin?
Actually,
take us through all that.
It was a long story, actually. My wife was, she's a physician here in USA. When I met her in Jordan, then she moved here. I finished my residency there, then we got married. My plan was to come here to USA literally to know about research, maybe a little bit for 6 months, and to see the country, to see USA. This is my plan, and was planning to go to Italy to do laparoscopic surgery there. Then I moved here. I loved it. I published my first paper, I guess, after like 3-4 months. I loved it. I said, this is what I want to do. But by that time, I didn't do my exams, nothing, no USMLEs, no SFMG certificates. So I had to do it from the beginning.
Sure.
My wife matched in cardiology here, so we had to stay. Then from then, I did research fellowship in the University of Arizona for 3 years. Then I moved to Wisconsin here for transplant surgery fellowship under supervision of Dr. Hang, and then I moved to University of Virginia to do further training They do more robotic there, so I wanted to learn more about robotic surgery at University of Virginia. After that, Dr. Hong called me. He offered me to stay here as a clinical instructor, as a plan to grow up more to
Great.
Assistant professor. But yeah.
Oh, that's fantastic. And what area of transplant really stimulates you? What kind of gets you excited when you wake up in the morning?
Kidney,
Yeah.
kidney transplant, pancreas transplant. It's more those two that I feel myself very confident.
Yeah, it's fascinating. There's so many people on dialysis right around the world, and people are struggling with what to do to find more organs. I think there are some people actually working on pig kidneys, right?
Yeah.
And thinking of trying to get pig. Where does that all stand?
Actually, they started. They did the heart he lived the heart from a pig to the human, lived around a month or 6 weeks, then he died for unknown reason. They did the kidney from cadavers in Alabama, actually, on a brain dead patient. So they put the kidney from the animal, from pig, to the brain dead patient, and the kidney went well for 3 days, was making urine, and so I think the future is for xenograft. The kidneys from animals. I think within the next, I will be hopeful, but maybe 10 years, we'll see that.
It'll become relatively routine.
Yeah, routine.
And the animals will probably be specifically bred, right, to donate their kidneys. Just fascinating.
Yeah, I feel like, I don't know, I'm very hopeful. I'm passionate about transplant, so maybe that's why that's what I wanted to have actually for our patient, is to customize the kidneys. That we can order the kidney for this patient according to the size.
Yeah,
so
wow.
maybe something.
Just fascinating.
Yeah.
What do you like to do outside of work? Our last question, Badi. What do you like to do out of work?
Actually, I like to I'm going to the gym. I do Peloton a lot these days. I finished my first
Great.
100 cycles last week.
Yeah.
And I'm going to the half marathon, Brewers Marathon, next actually in 2 weeks. So.
Oh, that's great.
What I do, yeah, and walking around the lake. I live in downtown, and so.
Yeah, I know my daughters are big into the Peloton, so
nice.
yeah, I'll have to get into that space at some point. But
it is nice, yeah.
Dr. Badi Rawashedeh, thank you so much. Great to talk with you, and Haley, thanks so much. We'll be back again with another faculty member very soon. Badi, it was great to talk with you.
Thank you, sir.